Hi, I'm Allison Croft with ASA TV. I'm chatting with Editor-in-Chief of Stroke, Vascular and Interventional Neurology, Dr. Ashu Jadhav. Thank you so much for taking some time for us today.
Thank you, Allison, for having me.
Yeah, appreciate you being here. So, Stroke, Vascular and Interventional Neurology, this is a new journal. So what makes this the right time to launch a journal in interventional neurology?
So the journal really is a collaboration between two societies, the American Heart Association and the Society for Vascular and Interventional Neurology. The field of endovascular therapy has changed dramatically over the last 5 to 7 years, and that really started with seminal trials that were published in 2015, which showed the benefit of endovascular therapy for patients presenting with the most severe kind of strokes that we see. Those are strokes due to a large vessel occlusion. Since those trials were published, there's been sort of a sea change in the way stroke is managed in the US and worldwide. Now that there's a new treatment, we need to get patients to the right facility at the right time to achieve the best outcome possible. Because of those trials, now there's interest in understanding which is the ideal population to treat, how do we increase access to all patients that are eligible, are there populations that were not studying those trials that could also benefit from endovascular therapy, and really the whole continuum of care has been reorganized to identify these patient populations from the pre-hospital setting to rehabilitation. So the timing of this journal really is to acknowledge that there's increasing interest in research and opportunities to improve outcomes in this population. So there's more publications that are being put out by multiple journals, and there really is so much demand for this type of literature that we felt that this is the right time for this specialty journal.
So then tell me more about how you're looking at research and what research you look for to decide what will then be published.
So the research we're interested in really is anything that pertains to the biology, the science, the sort of systems of care that center around this population. So this could be basic science research that focuses on novel medications that can open up blood vessels. This can also focus on animal models that are testing new devices, to epidemiology of where patients live with the highest risk for these type of blockages, as well as the type of predictors of outcomes, both in the acute setting and in the long-term setting. So we're really interested in the continuum of care in this population of patients.
So once an article is published in Stroke, Vascular and Interventional Neurology, how then does the journal help authors get their work noticed?
So one of the things we're really excited about with this journal is that it is an open access journal. And what that means is that once the article is published, accepted and published, then it's available to freely download for any provider, any part of the world. And this is very important because a lot of our sort of interest nowadays is understanding the disparities in care. That is, certain individuals don't get the same level of care as other individuals. But what goes along with that is also access to the best science to provide the best type of care. So while in some places you can freely access just about any article and pay the fees to have that subscription, with this journal you can be in any part of the world and you don't need to pay a separate subscription to download these articles. This allows free access to both the developed world and developing world as we're all trying to grapple with this population.
That's incredible to have that kind of access anywhere in the world.
Absolutely.
All right, so a little bit about you now. What is it like to be an editor-in-chief?
So, it's a good question. I think that when I took on this position, I had experienced reading papers, writing papers, also as an editor for other journals. And so I had some sense of how things worked, but really starting a new journal off the ground from scratch is really trying to get a balloon off the ground. We're just really trying to understand the logistics of how everything sort of works to make that successful launch. And this has been really supported by many, many people. I would say that the American Heart Association and the Society for Vascular and Interventional Neurology have been critical in first having the vision to have this journal come out at this time. This project has really been in the works for about 3 years now. And so finally we're seeing this journal be published really at an exciting time in the field, but it's taken a lot of groundwork to get it off the ground. So what that means is we're trying to be inclusive in terms of the type of editorial team we have. This is a type of condition that affects patients, but multiple team members come together to get the best outcomes. So that includes neurologist, stroke neurologist, interventional neurologist, radiologist, neurosurgeons, as well as emergency medicine doctors, cardiologists. So we're really trying to bring together an editorial team that reflects that sort of multidisciplinary aspect to this type of population. The second thing that we're trying to do is really use a digital strategy to increase awareness about the latest findings. Right now, there's thousands of journals publishing articles every day, and it can be overwhelming as the consumer, as the physician, or as even the patient to understand, okay, well, what are the findings and which are the articles I should pay attention to? And the ways we're trying to bridge that gap is we're using digital strategies to basically say, okay, this article came out, these are the major findings, that gets published online on our website, so you can download the PDF, but we also simultaneously use social media to generate awareness about that article. We use a concept called visual abstracts. Visual abstracts are kind of a pictorial of the major findings of that study, so that people at a glance can see what is the bottom line of that study, and then they can do a deeper dive if this is of interest to them. We're also using podcast to have more of a behind the scenes insight into what authors are thinking about approaching the problems that they're researching and publishing on. It allows for discussion between other panelists that were not involved with the original article. So this kind of discussion puts that article in context and can fuel future ideas for the next steps in that research.
And so many people are using podcasts and social media right now to get information. Are you seeing that you're getting people to consume this information easier because of that?
Absolutely. I think that we're all different types of learners. Mm-hmm. Some people learn very well by reading directly from text. People also are finding that there's other ways to get that information out there. The podcast is a great venue because it's something that people can listen to on the go, on their drive to work, and it gives them another way to receive that information. So for some folks, this is a better way to consume content than just directly reading the article. But it also allows folks to see the discussion that happens between participants of the research and of the panelists that we select for these interviews. So it's kind of a multi-strategy approach to really increase awareness about the content.
Well, very interesting. Thank you for being here to talk with us about this topic.
Thank you very much.
Yeah, thank you.